Hello, I am Janine Boyd, and I am honored to serve as the Regional Director for Region 5 of the United States Department of Health and Human Services. Our regional office is based in Chicago and serves Illinois, Indiana, Michigan, Minnesota, Ohio, and Wisconsin, as well as 34 federally recognized American Indian tribal governments on behalf of the department. Region 5 is also the home to abundant academic medical centers, health policy research institutions, medical and dental associations, and innovative community-based organizations. The unique makeup of this region requires attention to racial and ethnic disparities and cultural attunement in establishing partnerships and communication channels with tribal, federal, state, and local organizations, and in working to address health inequities across the region. So what does our office do? Our regional office is your front door to HHS. My team is poised to answer questions, provide information, and assist with resources for the work you are doing. Every day, my team is engaged in meaningful conversations with governors, mayors, tribal leaders, and partners like you about HHS policies and programs to ensure that our efforts are informed by your experiences. From their first day in office, the Biden-Harris administration and Secretary Becerra have been focused on improving the health and well-being of all Americans. From tackling COVID-19, addressing the behavioral and mental health crisis in our country, to expanding access to and reducing the cost of health care, this administration has made real progress on our priorities. We have more tools than ever to prevent, fight, and treat COVID-19, including vaccines, boosters, and therapeutics. We are working tirelessly to ensure that no matter who you are or where you live, you can access health care free from discrimination. In the last year, we've also worked to expand access to health care, especially to more Americans in marginalized communities. During the 2022 open enrollment period, a record 14.5 million people enrolled in quality health care coverage in the marketplace, including nearly 6 million new enrollees. And during the pandemic, Medicaid and the Children's Health Insurance Program enrollment grew from 71 million to roughly 83 million people, the largest single increase in the program's history. We've reduced health care costs and proposed a rule to make hearing aids over the counter, which would benefit roughly 30 million people with mild to moderate hearing loss. Finally, we've prioritized behavioral health and invested billions in programs, block grants, and other initiatives. In October, we rolled out a new strategy for overdose prevention, and we launched a national tour to strengthen mental health on the heels of the State of the Union. Looking ahead, we will continue building on this great work, and that includes implementing the new White House COVID-19 plan to protect against and treat COVID-19, continuing to be proactive in addressing mental health, which the President has made a national priority in 2022, and continuing to fight to curb prescription drug costs, making child care affordable for all, and strengthening home health care. Friends, this administration, with your help, has made significant progress, and yet there is more work ahead. I look forward to working with you to serve the people of Region 5. Thank you again.
Produced by the U.S. Department of Health and Human Services.